Obesity. Obesity does have an associated risk for an increased risk of developing dementia, and it's partly linked because of it's partly linked because of its association with diabetes and high blood pressure. And the reason is because obesity inflames the body's cells, and of course, when you have, if your brain cells are all getting inflamed and expanded and such like, then that's going to cause issues like. And that's exactly what happens in obese people, is that every cell in their body, virtually in tissue anyway, gets expanded and irritated and inflamed in some way. As you imagine that going on in your brain, it's not surprising, and there's some link with changes in the brain which then could lead on to dementia. It's a sort of a knock-on effect, really, I guess, as far as the brain cells are concerned, because the brain cells are more sensitive than other cells in the body, and if they get inflamed, then there's a risk of overprotecting them, let's say, or an overactivation of our own immune system. So our own body immune system could, in fact, tip us into the dementia world, simply because of the reaction to the expanded inflamed cells. But there is some good news if you are obese, or if you know someone who's obese, and to lower the risk of getting dementia because of the obesity, then they've shown that people with a BMI of 25 or more, if they lose 2 kilos, that's enough to start the reduction in the risk of dementia. So even a reasonably small, I know it's a huge effort even for that tiny amount for some people, and I do, my heart bleeds for you in that case. However, knowing that fact, is that an extra incentive for someone to lose those extra 2 kilos, or the first 2 kilos, let's say, because there's an added benefit of you not getting dementia in later life. I myself have checked my BMI, and I was over 25 at some point, or some figure anyway. It was the one that said I was mildly obese, or close to being mildly obese or something. So I'm going to give myself half a point for obesity, because I've virtually touched it, or let's say I've been close to it, like, yeah. So did that have a bearing on my diagnosis of dementia? Maybe. Just to give you a bit of a figure then, so anyone between 30 and 65 that's classed as clinically obese has a 30% more chance, or higher risk of getting dementia in later life. There you go, that's just the fact. See you in the next clip.